Thank you for tuning in to North Point, Making Health Happen. My name is Biftu and I'm your host. This is a new series brought to you by North Point Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community. We will feature guests from our team and around the community to talk about the health and wellness issues most important to North Minneapolis. Together with our guests, our community, and you, our listeners, we are partnering to create a healthier community. Today, we are joined once again by Dr. Rahshana Price-Isuk, Director of Clinical Services here at North Point Health and Wellness Center. As a Minneapolis native, Dr. Price-Isuk is passionate about service to the Minneapolis community. She grew up both in North and Northeast Minneapolis, attended Northeast Junior High School, and graduated from North Community High School. After finishing medical school, Dr. Price-Isuk returned to her community and attended family medicine residency training at the University of Minnesota Broadway Clinic and North Memorial Medical Center. Dr. Isuk has a passion for health education. She desires to teach patients how to take ownership of their wellness, and her goal is to empower people and communities to take control of their health and well-being. Dr. Price-Isuk looks at each visit as an opportunity for learning for both herself and the patient. And we are thrilled to have Dr. Price-Isuk join us for a conversation today on colorectal cancer awareness. And this is a topic I believe that's near and dear to your heart, Dr. Price-Isuk. So welcome. Thank you for joining us again. And we'll dive right into our questions.
Absolutely. Thank you for having me.
Thanks. So let's talk about colorectal cancer awareness. Can you give us a definition of colorectal cancer?
Sure, yes. First, I have to say my plug is that colorectal cancer is one of the most treatable, curable, and actually preventable cancers that there is. So, prevention of even getting the cancer is possible and key. Cancer within itself is when cells tend to multiply, divide, grow at an abnormal rate or in an abnormal manner. So that's the root of all cancers. And colorectal cancer is a cancer of your colon, what some people call the bowels, and the rectal or anal area.
Okay. And going further, can you define this word for us? Polyp, Polyp. What is that?
Yes, absolutely. That's a great question to ask. Again, cancer of the colon is preventable, treatable. And most colon cancers will start as a polyp. And as you so spoke, Polyp, a polyp. And I like to explain to people a polyp, I liken it to a skin tag. So if anyone's ever had a skin tag or a mole that actually dangles or hangs off of their neck or other part of their body, a polyp is like a skin tag, but it's on the inside of your body. And those polyps are often precancerous or benign, meaning they're not cancer at all. They are strictly like a skin tag or a growth that is non-cancerous. But over time, those polyps can become cancerous. So again, if people are screened and we can detect polyps early and remove them, we can prevent anyone from actually getting a colon cancer.
Can you talk to us about the causes of colorectal cancer?
Sure. Yeah, absolutely. So, cancer is a big, scary word. Some people call it the big C, things like that. And a lot of cancers can actually start spontaneously, meaning there's not a direct cause. And as we get older, our risk for many types of cancers increase just based on our age. So when we talk about colon cancer, we like to speak in terms of risk factors or what puts us at risk for colon cancer. And one really, really big risk factor is having a family history of colon cancer. So if you have a sister, brother, mom, dad, or grandparent who has colon cancer, then you're at risk. Or if they've had a polyp, you might be at risk. And I'll just give you my personal example is that my
Sure.
father's father, so my grandfather, he had colon cancer. He actually died from colon cancer at age 43 years old. So I never met my grandfather. And then my father, he's just turned 70 in the month of February. He had a history of polyps, but he did get his screenings and he got his colonoscopies as frequently as recommended and has been cancer free and never had a colon cancer. And so me, myself, that put me at risk. And so instead of having a screening at the recommended age 50, now 45, which we'll talk about later, I had a colonoscopy at age 40 because my grandfather had colon cancer at 43, probably much younger actually than 43. So that's kind of how that works. That's one of the major risk factors of colon cancer. Some of the other things that put us at risk are the same things that we talked about, Biftu, during Heart Health Month. So having a poor diet, actually red meat and beef has been linked to colon cancer. Not eating enough fruits, vegetables, and high fiber foods, leading to things like constipation. And then not being physically active. And so those are the things that can put us at risk for colon cancer.
Okay. And then moving further along, can you tell us what signs or symptoms we can look out for those who are at risk for colorectal cancer?
Yeah, absolutely. And I'm going to say my tagline, colon cancer is the most preventable, treatable type of cancer that we have. And I say that because people often will come into the office and they say, well, doc, I feel fine. I don't need a screening. The survival rate and the stage of your cancer is often much more advanced by the time you have symptoms. So I always tell people we're trying to prevent, we're trying to catch things before you have symptoms, before your body tells you that there's a problem.
Right.
Having said that, we should be in tune with our bodies and we should watch out for warning signs. So some of the warning signs that something is wrong in your what's called the colon, or what some people refer as the GI tract or the gastrointestinal system, would be any type of change in your bowel habits. So if you all of a sudden are experiencing problems with constipation and stomach pain, or to the reverse, you're all of a sudden having diarrhea or very loose stools, in addition to blood in the stool. There's many reasons why there could be blood in the stools, and they're not all cancer. But anytime you have blood in the stool, you should seek your healthcare provider or a healthcare provider. Blood in the stool, it can be bright red, it can look dark red or maroon, it can look black. So any of those changes in your bowels, you should seek the advice of a healthcare provider or go get it checked. And people often won't look at their bowels, but you should. You should look. You should know.
That's
know what's
true.
going on.
Yes.
You actually should look and kind of know what your norm is. So
yeah, absolutely.
Yeah. And I could do a whole, you can invite me back and we can do a whole talk just on constipation and bowel health within itself.
Sure.
It's a huge thing. So
we can certainly have that conversation. There's, there's no boundaries for what we'll talk about health-wise. So it's of course, an everyday conversation, it might seem like an uncomfortable topic, but in this setting, we'll destigmatize and talk about those kinds of things, because it is important to look out for signs and like you said, be in tune with your body. Can you tell us about how common colorectal cancer is and who is at risk, most at risk?
Yeah, absolutely. Very important. Colon cancer is extremely common, and that's exactly why we screen for it. We can save so many lives through screening. It's the third most common diagnosed cancer outside of skin cancer.
Mm-hmm.
And there's been many, many advances made in screenings, treatments, early detection. But despite all of these advances, African American males and females
Mm-hmm.
are still experiencing higher rates, so a higher incidence, and higher mortality rates, so more
Mm-hmm.
deaths and more diagnosis, even compared to other minorities like Hispanic females and Native American males. So, very important, especially for a large population that North Point does
Mm-hmm.
serve, that we are educated and that we look into these screenings.
Okay. Can you talk to us about reducing or preventing colorectal cancer in our everyday life?
Sure. Again, cancer prevention is a lot about healthy lifestyle.
Mm-hmm.
But, in today's advances, one of the most important, most effective, most proven, most efficient ways to prevent colon cancer is to get a screening, to
Mm-hmm.
get the right screening at the right time. And outside of that, it's again staying active. It's healthy for your heart, healthy for your
Mm-hmm.
colon, healthy for everything, your stress levels. Not smoking. If you are a
Mm-hmm.
smoker, please quit because it increases
Mm-hmm.
your risk of colon cancer, bladder cancer, lung cancer, and all forms of cancers. And then eating more fresh fruits, fresh vegetables, and drinking plenty of water, just as an overall health tip
Mm-hmm.
to prevent that risk of cancer.
So if I was someone who, was in tune with my body and I noticed some differences in how I feel or even in my stool, what do I do to screen for colorectal cancer?
Okay, great question. And I'm glad you're also reminding me about kind of early detection and what that means and what
Mm-hmm.
ages. So there's a little bit of a difference. I want to say if you're having any type of abnormal symptoms, I want you to
Mm-hmm.
talk to your healthcare provider.
Okay.
When we talk about screening, screening is done when you have no symptoms at all. Okay.
Okay.
If you have symptoms, you are going to see a healthcare professional and they're going to recommend what's called a diagnostic workup or a
Mm-hmm.
diagnostic test and
Mm-hmm.
assessment. For our community, I want to be very, very, very clear that screening is done on a population level without symptoms, meaning if
Mm-hmm.
we screen thousands and thousands of people, we are going to save X number of lives, okay,
Right.
before any type of symptom occurs. So, the American Cancer Society has
Mm-hmm.
recently moved their screening recommendation from 50 years of age, this is for colorectal cancer screening, from 50 years of age down to starting at 45 years of age for the general population at an average risk of colon cancer.
Mm-hmm.
Um, so I recommend that if you are age 45 and you want to look into a screening, number one, talk to your doctor. But number two, if you have insurance, call your health plan and
Mm-hmm.
see that they are covering this new recommendation. Sometimes it takes
Okay.
a little bit of time for health plans to adopt new recommendations by
Okay.
certain societies or what have you. If you are high risk, you will definitely likely get a screening covered at 45, which means you're African American,
Mm-hmm.
or if you have a family history, you might even need a screening sooner than 45. So that's kind of the general concept around screening.
Okay.
And then you'll get screening all the way up through age 75 years old. Okay.
Okay.
And anyone over 75, that should be a discussion with your doctor to see if screening is still recommended for you given your health at that time. Okay. So if
Okay.
you're a very healthy, active 78-year-old and you
Hmm.
might live till 98, then you should keep getting screened. But those are
Sure.
discussions that have to happen one-on-one, kind of in the doctor's office. Okay.
Okay.
So now I'll kind of lay out, you asked me about different screening options.
Right.
So would you like me to lay those out now?
Yeah, absolutely. Let us know.
Okay, sounds good. So the great thing is that there's more than one option and you don't always
Hmm.
have to get a colonoscopy.
Okay.
So the first option would be something called a FIT test, which is just a stool test you can do at home. And your
Hmm.
local primary care clinic, including North Point Health and
Hmm.
Wellness, can give you a small card or a kit that
Hmm.
one would take home, and you would give us a stool sample, basically.
Sure.
And that stool sample comes back to the clinic and gets processed, and we let you know if it's positive or negative, meaning if they find any traces of like traces of blood or other signs of cancer that can't be seen with the naked
Hmm.
eye, meaning you can't see them when you look in the toilet. um,
Sure.
It'll trigger positive and you'll get a call. But any positive um, non-invasive screen like a FIT test or a home test will have to be followed up by a colonoscopy.
Okay.
Okay. But just to keep it simple, your first option is just a simple stool test that you do at home, and you have to do
Hmm.
that once a year, every year. Okay.
Hmm.
The second option is another home stool test. It's called a Cologuard. And if people are listening out there, they may have seen the new commercials with the little dancing toilet. There's a toilet
Yeah.
dancing now.
I've
Yes.
seen it. Yeah.
Yeah, that's the Cologuard test, which has shown to be a very good test for
Okay.
people who are at average risk, not high risk. It's still a
Hmm.
home stool test. It's a little more specific for detecting um, polyp, precancerous material, and
Sure.
it's every 3 years. So if it's negative, so the first test was a home
Hmm.
test. You have to
Hmm.
do it every year, once a year, to
Hmm.
be effective. The second test is the Cologuard test. It's a home stool test. It's good for every 3 years if it's negative. Okay.
Hmm.
Then your third option is full colonoscopy,
Hmm.
where they're looking inside the colon, a
Hmm.
direct visualization, looking in the colon for those polyps and any signs of cancer, which they will remove a polyp right during your colonoscopy if they see one. If a
Hmm.
colonoscopy is normal or negative, you don't have to get any screening for 10 years.
Wow. Okay.
Yeah, so that's kind of a benefit. There's
Right.
pros and cons. There's
Hmm.
pros and cons to each of these tests. With the colonoscopy, if they do find a polyp,
Hmm.
even if it's non-cancerous, they
Hmm.
will recommend that you do another screening in maybe 3 years or maybe 5 years, depending on the
Hmm.
type of polyp that is found.
Sure.
And that again is to monitor to see if more polyps come about and to make sure that we're preventing anyone from getting a colon cancer.
We'll stay on the topic of colonoscopy because I think that one might be the most common or the most associated. So the two screenings that you mentioned before the colonoscopy, I didn't know about.
Okay.
So I think that's great. People know that there are some home tests that they can take, and maybe that will give them a little bit of peace of mind. But for a colonoscopy, can you tell us how difficult of a procedure is that?
That's a great question. And I do first want to address what you said about the colonoscopy being the most common thing that people think about when we
Mhm.
say, oh, you're due for your colonoscopy, you're due for
Mhm.
your colorectal cancer screening. And they're like, oh, no,
Right.
I don't want a colonoscopy. So
Right.
it's not fitting for everyone. We used to
Mhm.
really push, as doctors and other healthcare providers used to really push, you got to have a colonoscopy. You got to have a colonoscopy.
Mhm. Mhm.
You got to have the right test for you, and you got to have the one that's most appropriate. So if
Mhm.
colonoscopy isn't fitting, there are other options. I just really don't want people not getting screened because of
Sure.
their fear,
Right.
of the colonoscopy.
Yeah.
But to answer your question, my running joke when I had my colonoscopy is that, oh, your colonoscopy is like the night before my wedding, a whole lot of drama, right? A whole
Sure.
lot of drama, a whole lot of tears for
Mhm.
5 minutes to say, I do.
Right.
So you're basically saying, the prep is the worst part.
Mhm.
But it's doable, so
Yeah.
the night before a colonoscopy, you do have to clean out your colon.
Mhm.
And you actually have to follow a certain diet for a
Mhm.
week or two leading up to the colonoscopy.
Okay.
So, yeah, so you get all those instructions, you follow a special diet. The 2 days before, you go on all clear liquids, so you might be a little hungry.
Mhm.
And then the night before, you drink this gallon of liquid, and you take these
Mhm.
pills for gas, and then
Mhm.
you basically stay on the toilet all night.
Sure.
um yeah, or sleep in the bathroom or do what you got to do. And then the next day, you see the doctor and you're given some sedation through an
Mhm.
IV. So
Mhm.
you're a little bit sleepy, you're not
Mhm.
fully under. And they do a scope. It's a little flexible, tiny, almost looks like a straw for people who are listening.
Mhm.
That goes through the rectal area. You
Mhm.
can't really feel much. You might feel a little pressure, but again, you're heavily sedated, meaning
Right.
almost, pretty much sleep. And
Mhm.
it can take, depending on what they find, it can take as little as 9 minutes that the
Mhm.
procedure is actually happening, that the
Okay.
scope or the camera is actually looking throughout your colon. It can take as little as 9 to 10 minutes.
Okay.
So that's kind of the colonoscopy in a nutshell.
Mhm.
Many people choose it for different reasons. If they say, yep, I want to
Mhm.
know and I want to get it over with and I don't want to worry about it for the next 10 years, then that's the option for you.
Great. Okay. Thank you. I think it's good to just kind of demystify the procedure and let folks know there's nothing to be worried about, and it's maybe not as scary as they thought it would be. Um, so we'll wrap it up here talking about North Point and the services that we offer. So for colorectal cancer screening, if someone wanted to come to North Point, what would we offer?
Yeah, absolutely. So at North Point Health and Wellness, as many know, we offer full scope family medicine services, and we would really want to talk to the individual about what works for them, and we can offer them the fit testing so we can send them home with a kit same day as their
Mhm.
appointment if
Mhm.
that is appropriate for them. And we can also refer them to for a colonoscopy. So we typically
Mhm.
refer to a local colonoscopy center. It's done, at a local hospital or at a local outpatient surgical center.
Mhm.
And then they would go through kind of the process with the colonoscopy center. So those are the things we offer around North Point, around colorectal cancer screening. Obviously, we
Mhm.
offering community education,
Yeah,
and we offer wonderful, wonderful, knowledgeable providers who can walk patients through the process.
great.
And Biftu, I should say, I
Mhm.
know you're going to want me to talk about it. We
Yeah.
offer services to help those who are uninsured,
Yes.
who do not have insurance or do not have the most readily available access to these services. So we can offer help with coverage of these screenings as well. So we have financial counselors on board at North Point to help navigate the situation.
Wonderful. Well, thank you to Dr. Rahshana Price-Isuk for talking with us today about colorectal cancer awareness. And yeah, thank you again for sort of demystifying everything and letting us know that this is not as scary as some people might think. We're here to help, here to alleviate any worries that people might have. So we appreciate the input of providers like you.
Thank you, Biftu. Thanks for having me. We're here to help.
Absolutely. Thank you. All right. Yeah. Thank you for listening to North Point Making Health Happen. We want you to know that we are here to partner with you, that you can dream, and that you can reach your dream. Please subscribe to our YouTube channel to watch our show in video format. And if you like what you hear, share with a friend. To read more about North Point, check us out on the web at northpointhealth.org.
When you walk through the door,